Hi, I'm Tom Calma and I'm an Aboriginal person from Darwin, Kungarrakan on my mother's side and Iwidja on my father's side. But I currently live in Canberra and I live on Ngunnawal land. So I pay respects to all Aboriginal and Torres Strait Islander people, and particularly our youth who are going to be our future leaders, the custodians of our stories, our cultures, our languages, our histories. And it's really important that we listen to our youth in these programs. I wanted to just spend a few minutes talking about the Tackling Indigenous Smoking program, which is a program that the federal government funds to help Aboriginal and Torres Strait Islander people across the nation to give up smoking, but also not take it up. 10 years ago, over half of our population smoked. It's now down to about 41%. It's estimated that about 50,000 Aboriginal and Torres Strait Islander people have given up smoking in the past 10 years, which means that we've saved around about 23,000 lives. Very important. Great job, but we still have a way to go because the general population, only about 1 in 10 smoke, 14% smoke. So the target is to help people give up smoking, but also encourage people who don't smoke to not take it up. So what's in the TIS program? Well, the first one is my position as a National Coordinator for Tackling Indigenous Smoking, and I mentor and lead the teams across the nation. Now there's 40 teams that are funded and they're all over Australia, and including the Torres Straits, one of our newest teams. They're in urban environments, in regional and in remote. So we cover off all of Australia. So there is that support out there irrespective of where you live. It's a program we all can get involved with. All it requires is that you ring a TIS team and get them to come out and work with your organisation or your group. The Aboriginal Community Controlled Health Services, the AMSs, also provide support for anybody who wants to give up. If you want to give up smoking and you want to talk to Quitline, you can ask them if you can speak to an Aboriginal or Torres Strait Islander counsellor. And if you can't, if there's nobody available, you can talk to any of the counsellors because they've all been trained to work with Aboriginal and Torres Strait Islander people. If you're in a big organisation and you want to learn how to give up, or if you're an Aboriginal medical service and you need support to train your staff, you can go to another program we fund, and that's called the Quit Skills program, which again is another very important one. It works with big groups and it also works in developing up policies and strategies to give up smoking, what we call brief interventions. If you are pregnant, it's important that you don't smoke, and so we fund a group called I Sister Quit, which works with both mainstream and Aboriginal Community Controlled Health Services to develop up these strategies, because it's important that we all do it for our health and to be able to maintain all of our people to enjoy the long life that we need to be able to enjoy if we're a non-smoker. Thank you.